Influenza is a contagious and potentially life-threatening respiratory illness occurring every year. When a new influenza virus emerges, it can lead to a pandemic, infecting large populations with often devastating consequences. Although unpredictable and occurring infrequently, influenza pandemics have caused a large number of deaths and created socio-economic disruption in the past. 4 influenza pandemics have occurred during just over 1 century: 1918, 1957, 1968, and 2009. The 1918 influenza pandemic was the most severe one in recent history. In 2009, the H1N1 pandemic spread to over 214 countries and territories, resulting in tens of millions of infections and an estimated 151,700 to 575,400 deaths in just the first year. More recently, the COVID-19 pandemic has yet again reminded us of the dangers associated with viral respiratory pandemics and the importance of preparing for them. In 2011, stakeholders and the World Health Organization jointly established the Pandemic Influenza Preparedness Framework, or PIP Framework. Its objective is to improve preparedness and response for the next influenza pandemic. The PIP Framework brings together WHO member states, industry, other stakeholders, and WHO to implement a global approach for pandemic response that is rapid, flexible, effective, and equitable. The framework is built on 3 fundamental pillars: virus sharing, benefit sharing, and governance. Through the partnership contribution mechanism of the PIP Framework benefit sharing system, influenza vaccine, diagnostic, and pharmaceutical manufacturers make annual cash contributions to WHO to improve pandemic preparedness and response in selected priority countries. Of all contributions received, 30% is reserved for the response to the next pandemic, and 70% is used to strengthen pandemic preparedness at selected countries. Benefit sharing also occurs through special contracts with manufacturers who provide access to in-kind products needed for any pandemic response. Influenza and other respiratory infections represent a major public health problem in WHO's Eastern Mediterranean region, a region in which complex emergencies and weak health systems make pandemic preparedness challenging. Within the region, 10 countries are beneficiary countries of the PIP partnership contribution. WHO supports member states of the region to establish functional Sentinel ILI/SARI systems and epidemiological surveillance, laboratories, health systems and health professionals, emergency response systems, and risk communications capabilities. Since the initiation of PIP support in 2014, significant improvements have been witnessed in those priority countries when it comes to influenza surveillance, pandemic preparedness, and response systems and capacities. Most priority countries have PIP-supported laboratories and trained human resources, and as a result, have been able to respond effectively to the COVID-19 pandemic. As of 2021, 19 out of the 22 countries and territories of the region have a functioning Sentinel influenza-like illness and severe acute respiratory infections surveillance system, while 18 designated national influenza centers and 4 national influenza laboratories are operational with the ability to detect and confirm unusual influenza viruses with human pandemic potential. The COVID-19 pandemic has highlighted gaps and challenges, including managing global supply chains at the time of an emergency and clinical surge capacity. Any lessons learned from the COVID-19 pandemic are critical to strengthening pandemic influenza preparedness. The PIP framework represents an important measure in safeguarding populations against the impact of future viral respiratory virus pandemics. Although a lot has been achieved within the region, more is needed in terms of implementing the framework. The world must remain vigilant for influenza viruses with pandemic potential, as they can emerge anywhere, at any time, with little warning.